presentation. That's something that is just stuck in my memory.
Yeah.
And that's changed me just from the perspective of being able to spot what that hypoxia looks like.
You didn't win her over necessarily from being, like, sweet and sugary and, like, all
Hmm.
that. It's just, like, by doing, like,
This
great
is what we
patient
have to
care.
do.
Yeah,
Yeah. Yeah.
I love that.
Hey everyone, and welcome back to Banter at the Bedside. We are so excited to be talking to you guys today. We are going to be telling stories about those who have touched us and changed us throughout healthcare. Could be patients, could be other healthcare workers. Sometimes it could be how it changes our practice or our approach to patients, or just those that we carry with us and remind us why we keep doing this job and show up to work every day. As always, this is for entertainment purposes only. We do not represent any entity at all. Our thoughts and opinions are our own. This is not medical advice. Please seek the care of your own medical professional. I'm Abby. I'm a nurse practitioner of 8 years in the ICU, been in healthcare 17 years, and I'm one of your main co-hosts. I'm joined with Kaylee, our other main co-host, a nurse of nearly 18 years now in the ICU.
Hey, everybody.
We're joined again with Mama, aka Amanda, nurse, an ICU nurse of nearly 20 years. She's here to share all her woo-woo and all her love for us.
Hey, y'all.
And then our resident attending today, or our physician today, is Dr. Armando. He is back and he is completing his long and rigorous training as a nephro critical care fellow. He is about to become an attending in a couple months. So welcome back, Armando.
Hi, glad to be here.
We're so happy to have this group back. I felt like the last time we all met, we had a great discussion. And this was kind of a topic that came up. I saw a couple different things on social media about those who touched us, and it really made me reflect about patients and other healthcare workers that have really changed me and shaped who I am as a professional. So I thought it'd be just a nice, easy storytelling thing. So, anyone have a story they want to share about how someone on their journey has changed them?
Let's hear Armando.
You have one. I mean, I probably, it's been, as you said, coming out of training, feels pretty exciting and makes you sort of reflect on your journey. I would first like to start with, I think my program director back in residency was a great guy, a type of doctor that will go bedside and, do all the rounds bedside and kind of teach you step by step how to do a good physical exam, good interrogation of the patient and sort of how to give bad news, good news, and explain the plan for the patient. I think through medical school, depending on where you train or where you go to school, you might get some of it or fragmented parts of it throughout your medical school, but having someone that actually sort of makes it all in one package and really show you the type of doctor that you should be, kind of going along with our last talk about being your human doctor, right? And sort of touching
Hmm.
the patient and connecting with the patient. I think my program director back in residency truly, truly changed the way I practice and how do I approach patients. Frankly honest, the guy who really taught me sit down with the patient, right? And sort of, be humble, be another person, friend, families. We want to give kudos now that I'm graduating to my prior program director. I think it really changed my life for good as a person and also as a physician as well. So I would like to start with that guy because I think it was phenomenal. He'll make jokes and kind of make feel like we're all in a family meeting rather than in a
Hmm.
very patient doctor hierarchies, scenario or setting. So kudos to him. And I will not say his name, of course, but kudos.
We'll protect his privacy even though we're just singing his praises. I mean, that's amazing. I mean, I think it's, teachers touch us a lot. When you come into healthcare, there's not a lot of like teaching how to teach though. Like, so when you do get like a really amazing program director, you do get like a really amazing preceptor or trainer, like it can be so life changing in how you approach patients and medicine. And what do you think? Like, you're about to become an attending. So, what do you think you're going to continue to carry forward from him? Like, how are you, like, you're going to be his legacy now?
Yeah, I mean, he keeps, writes me every year too, at least close to my birthday. Sends always a message or kind of like at the end of the academic years, he texts like, are you still like a fellow or like are you graduating or doing something else or whatnot? So I think for your specific question, I think probably just very simple thing, just sitting bedside with the patient. I think that is every time I do it, it reminds me of him.
Mhm,
And I don't think maybe he does, but sometimes people, teachers they can go on and really not notice how much impact they can have on learners unless a learner comes back and tells them about it and so on. But really, it's simple thing from him. I would say just sitting bedside with the
Mhm.
I think it don't matter if they have a big ulcer in the leg or has discharge in it or not. Just make some room in the bed. Just sit there at the bedside. That's just a big
mhm,
act of kindness. And I think, patients will always remember kindness above all things. So yeah, I think that's one thing from him I'll remember. Take for me, take
mhm,
my entire life.
It's like, with your parents and teachers, it's like you can take things with you that you really like that they did. You cannot take things with you that you're just like, this just does not work for me. And I can imagine, Armando, that a lot of teachers, especially some of the physicians, were very black and white, cut and dry. These are the rules. This is what you're doing. Maybe even punitive to some degree.
I think very by the rope, by the book. Some attendings,
Hmm.
teachers, they can be very good teachers. Don't get me wrong,
Sure, sure.
but does it might not create that connection, right?
yeah,
With your learner. And
Hmm.
I think once you connect really deep, then learning it becomes very easy because everything sort of kind of flows in, and you develop a story, right? A story for your learning
Hmm.
moment that you can easily go back on your mind and connect to it and enter into that memory and then
Hmm.
sort of, take care of the patient. So
mhm.
yeah, that guy was awesome. He was taking his pilot license too during that time. So yeah, I never got to actually fly with him, but he used to tell me,
Oh.
once I get my license, I'll get you up there. I was
Mhm.
even thinking about proposing my wife on an. With
Oh,
him.
no.
So that's how much he sort of connected with me. Yeah, it was pretty cool guy, pretty cool guy. Anyone else? Any other
Yeah, I mean,
experiences?
I had some nursing instructors in school that just it's a lot like what you're saying, Armando, just connected with us. It wasn't as I mean, you've got to be very by the book and very policy driven, but just being able to have that intentional connection with someone. And I remember after, gosh, it must have been one semester, she was my favorite teacher, one of my favorite teachers, one of my favorite teachers, but she had everyone at her house afterwards. What instructor does that? Allows people into their home and cooks for them and had just a little celebratory get together, and I'll never forget that. I thought that was very kind.
I
Yeah.
think that's a humble act, bringing people into your
Mhm.
home.
Hmm. Oh, for sure. For sure. You got to really trust in people to do that. I don't know if she did that after every semester. We were probably her favorite. Let's be honest.
Had an instructor in nursing school that did that as well after she was like clinical instructor. And at the end of the semester, she had us over. I was a couple
Oh,
years after you. I wonder if it's the same person.
Mhm.
It
might
was
have
nice.
been.
I do have a slightly different story. She wasn't an instructor, but she was like a charge nurse preceptor on the unit. And I was young and I have a lot of natural leadership skills, as I've been told throughout my life. And I was new on the unit, but I was growing. And when I was bedside nurse, much to probably a lot of your surprise, I was a bit of a prankster. um, I played a lot of pranks on my nursing unit as a bedside nurse. There was some nurses that I know that met some of the nurses that I trained, and they were like, "Oh, Abby, she's super funny, isn't she? Like, she's hilarious." And they were
I
like, "I
mean,
don't
you
think
are
we."
funny. You're
Just too all
hysterical.
right. You're still young and you're still funny, by the way.
Yes.
Yeah, you're still young. You're hysterical. We'll be texting and you say something. I'm like, where in the world did that come from?
I know.
But it
Truly.
was It was much more surface level, like, it was kind of always there, it may be inappropriate at times, and this charge nurse sat me down one day. It was the start of my shift, and I was coming on as charge, and I just always believed, like, work should be fun, like, yeah, we're here, but we should have fun,
Mhm.
and she was like, "I would like to talk to you," and she brought me into the room, and she basically spent, like, 20 minutes, telling me how I'm a leader on the unit, I'm a natural leader, and that all the silly stuff that I do is inappropriate and it's making all the other younger nurses do it. And while I can do it and be silly and get my work done and my patients are taken care of, other patients are being harmed because the other nurses aren't doing it and that it's my fault. And it like went on and I like left crying and I was like, okay, so I'm terrible. Um, I'm just this terrible, terrible person. And I tell this story because for a long time, like I tend to overcorrect. So I shut it all down. And I think then people were like, ooh, Abby's really cold.
Go.
And it's taken many years to kind of unmesh myself from that and find a balance. But I also now, with older eyes, can look back on that moment and realize it could have probably been approached gentler, but it was approached with such good intentions. Like when I look back at it now and it's with older eyes, I can look back and be like, okay, well, she was trying to guide me to be a more effective leader. Like she was trying to teach me to be a more effective leader. Could it have, again, been done gentler? Probably. Could it have been received from someone that I had a better relationship with? Yeah, probably. But I do reflect on that because it did change me in so many ways. And for a long time, I held a lot of like, it changed me in a bad way. And I held on to a lot of anger. But now I actually look on that moment with a lot of gratefulness and a lot of respect. I wish it had gone different, but I'm still grateful for that conversation now. And so I just wanted to highlight that like you can have amazing people and maybe sometimes in youth you might not realize what someone is doing for you in that moment.
What patients got harmed by other nurses from you being silly?
Sounds like not a you problem because you got your work done.
I don't think patients were truly being harmed, but I think her point
That
was
seems
that,
harsh.
yeah, people were being
Yeah.
That's a
distracted
stretch.
by me.
That's a stretch. I
Yeah,
would
I
agree.
think so. I think that the accountability needs to be with the people with the actual issues. Now, if there were issues with things that you were doing or patients were harmed or near harm, or that's different. But come on
Hmm.
now.
So you just went full 180.
I
Yeah.
guess she was more from the leadership perspective. I guess she was more concerned about the work environment dynamics rather than per se your patient direct care.
It's like she
Yeah.
should have said that, articulated that better then,
Yeah.
you know?
My question for you, Abby, is have you seen this preceptor since that time? Have you come back
We
to
had to
her?
we had to work together for a couple of years after this.
Okay.
So but I have not seen her since she unfortunately passed away. So I have not seen her since.
I mean, she has a point though, because I do know that like younger nurses, if they see the older nurses goofing off, they think they can do it. And I'm like, no, I've done all my work.
Hmm.
I know everything about my patient. You don't. So like
Hmm.
I get that, but also it's not
Yeah.
my fault that you're not doing what you're supposed to be doing in my mind. But I get
We've
what you're
had
saying.
some
Like that
had some
changed your
pranksters. I can think of like 2 or 3 pranksters between nurses and providers, and I don't know, maybe it just wasn't a culture that we established. It was just a few people who did not harm anyone or patients, but just like a little joke in the
Hmm.
day, just
hmm
a little smile brought to your face, and no
hmm
one
Yeah.
was, put down. It wasn't to put down anyone else, but I don't
I
know.
just
It
hate that
wasn't.
she like crushed your spirit for a little bit. Like that
Yeah.
makes me sad.
Yeah.
Well, you know,
But
Abby, she
But
thinks she's in trouble.
it's like diamonds, right? You have to break them down for them to become even
mhm.
better, right?
Oh,
So yeah, kudos for her. I think for your points, well said, Abby. Like having people sometimes that can really be doing stuff for you that you don't even realize. And
Mhm.
mhm.
I think
Yeah.
at the end of the day, make the leader that you are, right?
Yeah. It's like
Yeah.
looking back and being like, "Ma'am, my parents were hard on me," or something, and it's like, "But really they were right, and I'm
Oh,
glad they were,"
yeah.
or something like that, like something that you
Yeah.
hear, things just come with
Like, gosh, they were really
wisdom and
strict.
age and life.
Yeah.
Mhm.
So, I like the, full circle moment where you're like,
You
"She
may
actually
not
did me a favor."
understand in that moment, or you may not get it
Mhm.
completely, but 5, 10 years down, you might say,
Yeah.
"Oh,
And that makes me think of the story that I thought of as far as like a coworker or somebody so I had been an intermediate nurse and then I transferred to the ICU and my preceptor was great. She was like on it, like knew all the policies, but like didn't let that stop her from doing what the patient needed, if that makes sense. It's like she was so by the book, she knew every policy, but if something needed to happen, like she would make sure it happened. And just, she was great, so much knowledge. But I had made a mistake where we had a patient who was there for cardiogenic shock and they had a very low EF and their blood pressure dropped. And this is when we had the residents. So it was like a first year intern or resident. I'm not sure. What is the first year called, Armando?
For residents,
intern."
is an
Uh,
intern.
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 Yeah.
So I let them know and they ordered a fluid bolus, which we don't typically do if the patient is there with a low EF and cardiogenic shock. But I was new. And so I started it and I told her, and she went in there and she was like, nope. She clamped it, she turned it off, and then she called him back and let him know why that was not an appropriate order. She was very professional. They said, thank you so much for catching that. And then she sat me down and told me why. And I was like, oh my God, like I could have, caused them to go into like distress or whatever. But the way she was telling me, like she didn't make me feel bad. She was like, this is why you learn, nothing happened. And it also helped me like internalize the fact that these physicians don't know everything. And I really have to be like on my game working here
Mm.
because that order was put in, approved everything. And it could have been carried out all the way if she hadn't shown up. So it's just like one of those things that was like, thank God that happened and nothing bad happened from it. Like a
Mhm.
little lesson, but like that was very early on in my orientation. It was like, no, I have to know exactly what's going on. I have to be the second line of defense or whatever it is. So
Mhm. That
I really
teaches you
appreciated
that
that.
confidence too, like, being able to confidently kindly talk to someone and say like, "Hey, let's talk about this order. There's some confusion. Can you help me understand?" I mean, you can do it in a very professional, kind way. I don't know
Mhm.
exactly who
Yeah,
you are talking about, and she was
you do.
a great nurse. Yeah, she was great,
Yeah.
and she had a way to be able to speak to people, and she's very convincing too.
hmm
But she
Yeah.
was tough, so that was
Yeah.
helpful.
Yeah. But I just remember that doctor came out. They're like, thank you so much. Like,
Yeah,
I'm so glad you caught that. I was like, okay, I can see sort of how this needs to be like transitioning from an intermediate to
to an
intensive
ICU
care.
nurse.
Mhm.
Yeah.
Yeah.
She was a great preceptor. I miss her.
I miss her too. She doesn't even know we miss her. Hopefully, she's watching this and she'll know exactly who she
Mm.
is.
Come back.
What about, I mean, we've talked about teachers and charge nurses and preceptors. Are there any like patient situations that you carry forward? Or I can go ahead.
I
hmm
have I have one that I can think of. It's not a warm and fuzzy story, but I will never, ever, ever, ever forget how a hypoxic patient looks before they die.
Mm.
I will
Mm.
never I will never get that out of my head. The distress this person was in, and she was pleading for help and assistance and not being able to breathe and wanting to get out of the bed and just fidgeting. And it went from 0 to a billion in less than 10 seconds. And we tried for a very long time and never got her back. And it's like one of those things that once you see a patient who is acting like that, you know exactly what's about to happen.
hmm
That
Mhm.
hypoxic presentation, that's something that is just stuck in my memory.
Yeah.
And that's changed me just from the perspective of being able to spot what that hypoxia looks like when the
I,
patients are
I'm
in
hmm
gonna
distress.
I'm gonna piggyback with that
Yep.
hypoxia because during COVID, I was a resident. I was a COVID resident, just
Mhm.
finishing intern year, becoming a second year on nights in Florida. As you can know, COVID started in January, trickled down to the south all the way, summer into autumn. And so, just going about what you were telling, Amanda, or talking about, I had this. I mean, we had this floor full of COVID patients, maybe like I don't know, like 80 patients in that floor. full
Mm.
ICU, no ventilators. You're doing what you can. PPEs, all that madness that was going there. But I had this couple of the husband was 71 and the wife was 75, if I'm not mistaken, and they were both there admitted, and the husband died one night.
Mm.
And the wife was like a couple of rooms come down the hallway, and I remember being called soon after when I'm pronounced the husband to see her because she was also in having shortness of breath. And when I got there, uh, I did have a very conflicted moment because seeing someone hypoxic, I agree, there's a very particular phenotype, right? But there's
Presentation. Yeah.
Mhm.
Yes.
to it, and
Mhm.
I could have seen that she was also gonna die potentially that same night, and I had a very conflicting moment that I didn't knew what to do at that moment in regards to telling her about her husband. I was
Mm.
so confronted by the idea of she's at her worst, she might be thinking that she's gonna die, and then I'm gonna drop the news that her husband did die and passed, and I didn't do it. And looking back, I wonder if and she ended up dying that night actually as well. And it's something, a patient experience that I really don't know even now how. I think some days I think it really shaped me for being more conscious about giving these bad news to people, kind of trying to think,
Mhm.
are patients really ready to receive this news or not. At the other time, on the other side was, well, she died and she didn't even knew her husband died, or maybe she should have. I really don't know what was the answer. I did
Right.
call the daughter that was over the phone and gave them two bad news in one night. But looking at that hypoxic way, right? Yeah, I agree. I think I have that same experience as you. I will never forget her look, and she ended up dying as well. So I don't know if you ever have to do something or have some experience like that, like giving
Mhm.
relatives dying very quick, very close to each other, in the same floor as well, same day, within 6 hours.
Mhm.
I don't know if there's any cues about how to really
Oh,
take that experience. I'm embracing it though. I
yeah.
think I'm more gentle when I'm thinking more through when I'm giving this end of life news to people than actually stopping and pausing and saying, "Well, how am I going to say this?"
Yeah.
But
Mhm.
It's
yeah.
hard. It's hard. You do the best you can with the information that you have in the moments that you have
Mhm.
them. To piggyback off of what you just said, Armando, I remember taking care of a COVID patient. This was on a different floor. And I remember, I don't know, something just told me like he needs to see his family. He needs to see his family. Well, of course, he can't see his family physically because he's in the COVID unit and there's no families allowed. And there were iPads accessible for patients. And I remember taking care of this guy and he was so sweet and we could not get him off BiPAP. And I remember it had been like 4 days. He'd been in the hospital for 4 days. And I said, "Have you seen your family?" And he said, "No, I haven't." And I just had a granddaughter that was born a few months ago. And something kept saying, "He needs to see his family, he needs to see his family." So I call his wife and say, "Hey, can we make this work where we can FaceTime your family?" She was like, "Oh my gosh, yes. I have this family member, this family member. I'm going to ask them to come over. Could this time work?" I said, "Yes, I will make it happen." And I try to, plan my day where everything was done so I knew for this time period. And you have to get all garbed up and you can barely hear what each other are
Mhm.
saying, but I remember him getting to see his wife and his other family members and that baby, and they were all in tears crying. And this guy was relatively young. And I remember being so happy that they were able to see each other and also so sad that no one had FaceTimed his family in 4 days. And I came back to work and I have some friends on that unit and I was asking about him and he died. I don't know if it was the next day or the day after, but it was soon thereafter he died. And I remember thinking to myself, I am so glad that whatever that gnawing, nagging feeling was within me that I listened to
Mhm.
because his family got to see him and they got to
Mhm.
talk to each other and see each other one last time. I will never forget that. I will never forget the
Ooh.
look of those family members and I will never forget how happy he was in that moment.
Mm. I just got chills.
I think that, right, that in itself does really, really pushes yourself, transforms yourself to a I
Yeah.
think for most of us in the healthcare industry, probably for a better person. I had a great friend as a teenager. His name was Armando, actually. He
The
was very,
Armandos.
yeah, the Armandos. We were playing on a quartet. I do play classical guitar, and we grew up doing that.
When
And
you can't love them anymore, guys, he goes and does
Armando
it.
plays guitar.
he was a year older than me, and I think one of my
Ooh.
earliest experiences that I think shaped the doctor am I is learning how life can be very fragile. And I think
Mhm.
in healthcare, did you have experienced that before becoming or before getting into healthcare? I think that helps you to sort of conceptualize all these, conversations about death and end of life. But my friend, he was 17. He died drowned. He drowned in Puerto Rico. He was a surfer.
Mm.
And, one of
Mhm.
the things that really kind of hit me and early, I was 16 years old. I was like, wow, life is very fragile. Was going to his funeral and see him all beat up because of, the
Mm.
currents will smash you to the rocks and whatnot. And the family kept his casket open, and then he looked a whole different person, Paul and Bruce and all these things. So, and I know I don't want to make this a sad podcast, but
No.
being a podcast about, things that sort of, touch us, at least for me as a teenager, that thing really showed me how fragile life is. And now being a doctor where we get to see, or, healthcare providers, we get to see people at their worst. I think being humble about that, about how fragile things can be physically, mentally, spiritually, is an important thing that we all should have, and we hope everyone in healthcare has. But sometimes I question myself: does everyone really knows how fragile life is, at least within themselves?
Yeah.
Not rationalizing. Yeah, sure, life can be
Mhm.
fragile, but feeling it. I don't know. I don't know if y'all have any experiences like that, but that definitely always stuck with me for 20 plus years.
Well, I think to follow up with what you were saying, Armando, I think that there are moments in our lives that are highlighted that much more how fragile life is. And I think we become, I don't want to say immune, because I don't believe that I'm immune to it, but I think it's more highlighted to us as healthcare professionals because we deal with this often. But, we're human and we take for granted so many things, even the people who try to be so intentional with their words and actions. We're going to mess up and we're going to, um, like I said, take life for granted. And it's something that you've carried with ever since you were 16, but I'm sure it
Yeah.
feels heavier sometimes than other times, just like with everything that we go through, it kind of hits you in waves.
Mhm.
Yeah, I can tell you, they did sort of help me deal with my mom loss. I lost my mom when I was 19. It's like going
Goodness.
from that to that did help when I'm looking back and looking at how my dad, processed this, my family and so on, being the youngest of five. I think I did pretty well for being a teenager at that point. But yeah, life is fragile. And I mean,
So
we as
Mhm.
fragile.
healthcare personnel, we're there to help people navigate those moments. I mean, that's
Mhm.
that's what we do, and we're proud of ourselves, matter of fact. But I don't want to keep these sort of ongoing, it's
I
kind
have
of sad,
okay.
positive stories.
They're sad
But
positive. I have positive positive.
I
Yeah,
wanted to
me too.
ask: is there any stories that
Shocker.
you feel like he empowered you even more, or kind of reiterated that you are good at what you're doing, and sort of make you keep going in your life?
I do, and this is one that I reflect on, and I had a relationship with this family after, and I do have some pictures that I use to reflect on. So I had a young patient, had a car accident, and had a very bad brain injury, very, very bad, was never supposed to wake up ever again. And
Ugh.
as they do, they trached, breathing tube in his throat, a peg tube, a feeding tube into his stomach, and came down to my step down unit. And the first day that I had him, I'll admit, I freely admit, as you continue to see these patients, you get a little compassion fatigue. And I went into the room and I was just kind of like, oh, another really sad case of the family making a decision that, I wouldn't make for my own family member. But I was like, all right, well, if they want to do it, we're doing it. Like we're
Mhm.
doing it. And I was like, if this is what they want, then I'm giving it my all here. And so I got this patient up. The first day I got them the first day I got them up to the chair right away in the morning. Got him back into bed. I got him up. I got them up to the chair 3 times that day, and every 2 hours, range of motion, bath, oral care, did all the things that you're supposed to do. And the mom, that first day, me and her butted heads. She was like, "They're not strong enough for this. They can't do this. What are you doing? Don't you know how bad their brain is?" And I'm like, "This is what they need. If we have a fighting chance, this is what we need to do." And the second day I came, did the same thing. And then slowly over time, I became their favorite nurse. And then they developed the Abby schedule and they wrote out my schedule on the wall, and it was the Abby schedule.
I bet the
And
other nurses were like, "Oh my
they hated me.
gosh,
Oh, they hated
3
me.
times? They're like, 3 times?
3
They
times."
hated me. They hated me so much.
That's
Oh
what
my
you're
God.
supposed to
I mean,
do.
you
That's
They were
right.
set the bar pretty
That's what you're
high
supposed to
too,
do.
right?
They yeah, and like, I mean, literally range of motion every 2 hours. I was going in, it's range of motion time. Every 2 hours, we're switching the boots, we're switching the splints, oral care twice a day, like all the things, favorite TV show on. And this is where it starts to get good. They were on our unit a long time. After a couple months, this patient that was never supposed to ever interact again started to give a thumbs up on command.
Whoa.
After a few more months, he was able to wiggle their toes on command. The patient eventually was able to walk and talk. Now, not going to be the fully functioning member of society that they were before, but a person that can function, that can do things, that can be with their child, that can be with their mother. And I got a voicemail from them that I keep and I will listen,
Mm,
and it is from the mom. The mom sent it to me. And rehab, the patient, the physical therapist came in, and these were the first words that he really truly spoke. Physical therapy came in and they said, "Okay, do you want to do more?" And he goes, clear as day, got it on recording. "No, I'm tired."
Oh.
And the mom was recording, sent it to me, and I use it to reflect on. And what it really did is those times when my coworkers hated me for the Abby schedule on the wall, the
Mhm,
times that I doubted the medicine, the times that I doubted the mom's initial decision, when I have those moments, I reflect on that case.
mhm.
Mhm.
Do I
I love
acknowledge that
that.
there's a level of miracle to that? Yeah, I do. But I can also acknowledge that there was a lot of medicine and science that helped that
Yeah, of
outcome.
course.
And it's so beautiful to know that. And we kept contact for many years. And this is not what I say. This is just what the mom has said, that they truly believe that without the Abby schedule, he would not. The patient would not have functioned as well. I mean,
Yeah.
on the unit, bedbound months, not a pressure ulcer on him, not a contracted
Yeah.
Hmm,
hand, foot, nothing, because of
hmm.
the Abby schedule that everyone hated. So I do
And
use
see,
that to motivate me.
that's why you can't convince me that God doesn't work through people, because that's you truly doing your work that you need to do. Now, were there other
Mhm.
disciplines that helped increase the likelihood of him being able to walk with PT, OT? Obviously, it's not
Yeah.
just one single person when we take care of a patient, it's a whole team approach. But I imagine that you started a standard and raised the bar to another level that
Mhm.
maybe he wouldn't have done so well without the Abby schedule, you know?
Mhm. Yep.
Good job, Abby.
That's awesome.
Oh, the science backs it up, right? You need to have
Mhm.
new stimuli so those nerves connection can rewire some way
Mhm.
somehow. So I wish we have a lot of Abby schedules even today. You know,
I know.
it'll be fun to make it like a curriculum part of physical therapy schools.
Yeah.
And they go and work for a week and do the Abby schedule for a week.
Yeah. I
I
don't
think
They
the
think so.
need
Abby
it.
schedule is like, I feel like we do that for certain patients, not for all
Mhm.
of them, but I think that would be great if we had the staff and the resources and the equipment to make that happen.
It was a lot. it was a fight, but
Mhm.
if there were more staff, it would have been easier. If there was
Mhm.
more resources, it would have been
We could
easier
even
for sure.
say it like ABI, ABI, ambulation, ambulation break intervention, ambulation break intervention.
Mhm.
Mhm.
Oh,
Mhm.
No, that's a
that's
great story. That's an
good.
actually successful story, to be frankly honest. After seeing so
Yeah.
many people with potential brain dead and prolonged comatose, I think we sometimes we don't get to see those stories. Actually,
Mhm.
I have
Mhm.
colleagues that have never seen a successful story like that, and can already frame them to say, well, here comes another one, as you said, the compassion and fatigue, and just throw the towel from the get go.
Mhm.
And hopefully, we still have good neurologists that will come in and kind of reel us back in into, hey, this could be
Mhm.
recoverable in a couple of weeks and months, especially young folks. But
Yeah.
that's a great story,
Yeah.
actually. That's a very
So,
great story.
I
it's
like
one of
that
my
you kept
favorites.
I like that you kept the voicemail so that you can refer back to that,
Mhm.
Yes.
because there are times where we say, "In the whole world do we do what we do?" And then there's
Mhm.
some days where we say, "Gum, this is why we do what we do."
Yeah.
Yes.
I remember being, gosh, this was probably 7 years ago. Now, this is me being very vulnerable. This is a lot of woo woo. So I need a very open mind for everyone as I tell this story. But I remember having a really hard time about 7 years ago and thinking, gosh, like I just feel this like change inside of me. I don't know what it is. I feel like maybe I'm better served in another job. And I remember I was struggling in that aspect or what I thought was that aspect. But I remember having this dream. And you know how you guys have a dream and it's like, oh, that was kind of weird. And then there's some dreams where you wake up. And I remember my mom would describe this as a hard dream. Like it was just thick. It just was laid on you. It just felt so real. And I remember
Mhm.
waking up feeling that way. But basically, what it was, this old lady was leading me to her husband. And she said, "Come here, I need to show you something." She said, "You took care of my husband." And the husband was in the bed and he was intubated and sedated. Like, I guess it was like before he died, because then she said, "He passed away, but you took care of him. And I just wanted to thank you for taking care of him." And I remember in the dream, she was dead too. But she was showing me her husband who had also passed. But in that moment when I was really struggling with like, okay, what's going on? What's going on? And I
Mhm.
remember waking up and like writing this dream down because it just felt so real. And it was like what I needed in that moment to say,
Yeah.
okay, stick with what you're doing. You're doing okay. You're making a difference. But I remember I've never had a dream like that. And I could have chose to blow it off, but I didn't. And
Yeah.
I still refer back to that where I wrote it down and say, okay, let me remind myself I am making a difference.
Hmm.
And I think that that's what I was hoping with this is that people will listen and take that moment to reflect on some of these wins or redirections or just signs from whatever power that be, whether it's our own signs, a higher power signs that we are doing what we're supposed to be doing, that we are all in medicine for a reason. It's hard sometimes. Like, it's hard sometimes on those days. Like, we all struggle. We all have moments of crisis of like, oh goodness, what am I doing in work and out of work? And I think it's just so important to have these stories that we remember. And I think you did a good job writing it down. Like, yes, it's a dream, but writing it down to just remind you, or like, I know Armando has stuff that he has shared from his program director that he keeps as a reminder, and my voicemail that I keep as my reminder. We
Mhm.
all have these reminders, and I think it's just so important that we acknowledge that and that we all need that too.
Mhm.
Like, we all
And it
need
might
that.
come across different for different people,
Yeah.
and you have to know how to look for it. Sometimes it might
Yeah.
be in your face and might be a call from your professor around your birthday to remind you. And sometimes it's something that, there I remember one day I was pulled to another unit and this family said, "You're like the Chick-fil-A nurse."
This Chick-fil-A nerd.
And I thought, "What?" She was like, "You just go above and beyond." And I thought that was
Oh,
kind.
I was like, "Huh?"
'Cause I was thinking to
That's
myself,
sweet.
did I use that verbiage, like, "My pleasure"? No, I don't use
A
that. You know
pleasure.
how you go
Yeah,
through
you
the
probably got
drive-through
pulled to a unit where they're all
and nothing about nothing. But what I am
Mhm.
gonna say is that that was very kind. You know, just it might be in your face. It might be something very quiet, but just look
Yeah,
for it because it's there.
they are there. And
I like
ask Go ahead.
sorry. I was gonna say,
Go
I
to.
liked in Abby's story how at the beginning, the patient's mom didn't like her, and then she became the favorite nurse.
Yeah,
Mhm.
yeah.
From
Like,
villain to
I
hero.
love that, where it's like, "God, why is she's making him do all this stuff, he shouldn't be doing that, he's not he's too weak for that," and then it's like, you see, like, she did all of this, she's doing all of this. These
Yeah.
Mhm.
other nurses probably need to be well, why aren't they doing that? And so I liked that because you didn't win her over necessarily from being, like, sweet and sugary and, like, all
Mhm.
that, it's just, like, by doing, like,
This
great
is what we
patient
have to
care.
do.
Yeah.
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 I love that, and I think it's awesome with the dream for Amanda because it's like, there are certain things in life that you just can't explain, and it's
Mhm.
no one can to my knowledge, like, we still don't know how we dream, why we dream what we
Mhm.
dream, and just like with medicine,
Yeah.
sometimes treating people, there's just things we can't explain, so I think it's
Yeah.
Mhm.
cool to show the connection.
The uncertainty, going back to my program director, he told me
Yeah.
also the uncertainty in medicine can really drive you crazy or empower you.
Oh, yeah.
Yeah.
Mhm,
So we all have to deal with that every day.
mhm,
Yeah.
mhm.
That's
Yeah.
Yes, the uncertainty in medicine, it can drive you crazy. I choose to let it empower me. I was uncertain getting that patient up 3 times a day, every day for a long time if it would work, and I trusted it, and it did.
Mhm.
And if it hadn't worked, it still would have been a job well
It's
done.
it would and it I still could have had pride in the fact that when that patient left our unit for, like, almo like, 6 months, I think. It was a long time. No pressure ulcers.
Yeah.
Like,
Not the
Mm.
fact that he wasn't, like, super atrophied, no
yeah.
foot drop, no like you
Yeah.
said, like, that's a win, I think.
Mhm.
Yeah.
It is still a win. Even if he didn't have the big recovery, that is still a win, and we have to find those wins too, even in the sadder stories. There's always a win or a lesson
There
that we
are.
can carry
That's right.
forward.
And when we get to see those wins, especially because, you know, with us being in the ICU, whether we transfer someone to intermediate or if they go straight to rehab because there's not intermediate beds, it's like we don't get to see them. We don't get to see how well they're doing. And so when they
Yeah.
come back, if they have a doctor's visit, you know, and they say, well, we just want to stop by. And, you know, I remember folks coming back. It doesn't happen regularly, but it does happen sometimes where they come back and say, look, I'm better. You know, we had
Mhm.
someone come back who was a cardiac arrest, and she came back with her family and just thanked everyone and how it's changed her life and what she now chooses to be a
Mhm.
part of and volunteer with and allowing people to learn more about women and cardiac health. It's just, you know, so many things that happen to you are just
Mhm.
for you and you just don't
Mhm.
realize it in the moment.
For any patients out there listening, I think it's also important to highlight that we do carry things forward. We
Mhm.
carry these lessons and these patients with us for years, years on end. I took care of that patient 10 years ago now, at least. It is a long time.
Mhm.
Yeah.
So there's so many lives that we touch in healthcare and so many lives that touch us in healthcare. And it's just important to highlight that and remember it and use it to continue to come to work,
Yeah.
do
Highly
what we
needed.
do.
Needed nowadays.
Yeah, do what we do.
I had a similar story like that. Just gonna summarize. I don't want to linger too much on this story, but this lady, she had bipolarism, and she didn't have much education in her background. Never completed high school, and probably you have seen someone with a psych disorder that gets labeled, right, and a sort
Mhm,
of frame in a certain way every time they come to the hospital. You know, being a double advocate, sure, half of it might be real, half of it might not. But I had this lady that really touched me in the sense of listening to patients. She came in many times to my hospital for headaches, and she has some migraine disorder. She has some pseudocerebral tumor disorder. She had other
mhm,
things that could cause headaches. So everyone and the anxiety and the bipolarism and how she was all crazy about it. No, my pain doesn't get better, doesn't get better.
mhm,
She'll get knows with medicine and pain will get better a little bit and then sent home with opiates or whatnot. But for many weeks, this lady came back and came back and came back and came back. And I think she really touched me in the sense that no one really sat down and listened to her complaints and ended up being a toothache. All she needed was someone to really tell her, you gotta go to the dentist. And she didn't have
No.
much family support. So I think the loneliness of not having someone to really help you once you leave the hospital, that also was a
Mhm.
teaching moment for me because, as soon as we figure like this might just be the wisdom teeth or something back there. And, no dentist usually goes to the hospital unless it's a big, big, big issue. So she
Mhm.
would, get lost to follow up every time she left home and left the hospital. So at one point she came back and she said like, dude, I haven't been able to get to a dentist. I don't have money and here and there. Bottom line, we managed to get one of my junior residents. I was a senior by then, one of our social workers to kind of help her out, find her a ride, coordinate the whole appointment to the dentist and whatnot. And I feel that story may align with you. Probably not as huge as your win, of course. But again, every win in a patient care is probably a
No,
decent win.
Oh, yeah.
everyone.
But it really touched me in the sense of reminds me now, even today, that if things are not matching, right? If you're doing
Mhm.
intervention and things are not lining up, you might need to listen a little bit more longer or ask the hard questions to really try to help people. So I think that moment
Yeah.
really kind of is a win-win for me and kind of empowered me. I got back to my home. I was like, man, it was this simple thing, and
Mhm.
can do
Mhm.
this. I'm a doctor. I can really impact people in a positive way. So I think that lady, I mean, she kept coming back to the office now to say hi
See, yeah, to
every
see
week.
you.
Yeah, I mean, see me, see the other ones, the intern
Yeah.
who did a lot of
Well,
the
and
heavy
she
lifting,
trusted
but
y'all and felt comfortable with y'all, I'm sure, and felt so
Mhm.
grateful. But then it goes back to what we talked about when we were all four together the last time. Although some of those things that she was complaining about aren't little things, but you just being there and being a social support. And, we all have to draw the line somewhere when it comes to certain things when folks come in through the ED or whatever. But
Mhm.
it's just the little things. It's just the little things that can make such a huge difference that we don't learn in a textbook, just being kind and being human.
Mhm. Yeah.
that
Yeah.
in medicine is called the hidden curriculum.
The
Yeah.
hidden curriculum, yes.
The things that we learn that are not in a textbook, right? Or in a
Yeah.
program.
Mhm.
Yeah.
Yes. But I still love that story. It doesn't have to be they don't have to be these big, like, miraculous wins either. They can be small
Mhm.
wins. And I'm sure
She
that
had
just
bad
didn't.
teeth, actually.
Yeah.
Next time she came, she had a whole new, she
All
was
new teeth.
a whole new mouth, and her problems got so much better. She was
I
off
bet.
opiates.
Oh,
I mean, a simple thing,
yeah.
but again, she got labeled by her anxiety
Mhm.
disorder, her bipolar
Yeah.
disorder, her
Mhm.
migraine disorder. I mean, they threw the toilet on her in regards to analgesia, and the pain wasn't there. Like 10 CT scan
Yeah.
after that, an MRI after, and I'm like, what the hell?
Gracious.
Yeah, so it was a toothache all that
And I'm
time.
telling you, tooth pain is awful. Have
Mhm.
y'all had
Mhm.
tooth pain?
Mhm.
An ear pain, tooth
Mhm.
pain?
Yep.
Mhm.
No, it's bad.
It's
Well, I was
bad.
gonna say I have a quick story about a patient, but it made me think about that because it's involving pain. Like when they say in school, like pain's the fifth vital sign.
Oh,
Fifth?
yeah. Yep.
And you're like, okay, 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 okay. But we had a patient, so this is like a while ago, and Amanda probably remembers this. We would get a lot of thoracic patients, and they would get this procedure or surgery, esophagogastrectomy,
Mhm.
and they would come out, they would have an NG tube, chest tubes, JPs, a bit back then it was still like a big incision, midline abdominal, like an incision on their side, an
Tube, J
epidural.
tube.
Yes, a G tube, a J tube, a epidural, a PCA, a Foley. I mean, there's so many lines and tubes, and they would normally be in the ICU. But this woman was in an intermediate pod for me. So she was,
Wow.
I think, had had surgery maybe that day or the day before. She was in the intermediate pod that we had had on the floor. And I was working a night shift. And long story short, she was in this unrelieved pain all night, and nothing I could do would help her. I had reached out to the anesthesiologist, the resident, the fellow, eventually the attending, the surgeon himself, the thoracic surgeon called to ask what was going on. And this is a very particular man. I'll just say that. And she was just writhing in the bed and nothing we could do would help. And I was like telling my charge nurse, and they were like, well, I mean, I don't know what you want me to do. Like, that's what they
Mhm.
said. And I was like, something's wrong.
Mhm.
I'm still a newer ICU nurse at this point, but I'm like, something is wrong. Like, I know she had surgery. I've had surgery, but she has all of these pain medications and it's not helping. And she cannot sit still in this bed.
Yeah.
And the next morning, they had to intubate her, give her like all these medications to get her still, take her to CT. And she ended up having to go to the OR. Something had leaked or ruptured, and she was in a bad way. And she ended up being on our unit for, I think, 3 or 4 months, multiple trips to the OR. She ended up getting trached, pegged, but she did end up walking out. She was there for so long, we had to have a hairdresser come and like cut her hair because it was all like matted and dirty. And she got her hair cut. She
Mhm.
was like up walking around the unit, had her little like downsized trach, but she was able to talk and she got out of there. But
Mhm.
I always remember that because I knew something wasn't right and I mean, like, I was like, well, she's had all this stuff, but I was like, it's not just pain. Like, you're not just in pain like that, that's unrelieved for that long for no reason. Mm. So if you're in school or you're a new nurse or something, or, you're turning your nose up at pain's the fifth vital sign. Well, I think it is. And
It
that was like
is.
a very clear thing that I have never forgotten. I was like, no,
Mhm.
Yeah.
that's not right. You
Mhm.
shouldn't be like that.
Yeah.
But that was just one of the ones I thought of. I was scared to death. I was like, "I'm gonna get in trouble. I'm in so much trouble."
You're always worried
No,
Why
about
did
what
you
getting
would
in
think
I
you were in
trouble.
explain?
trouble? Because we had this really intense epidural
No.
and, like, PCA policy, and it was like, you can't give any other narcotics if they have an epidural.
Yeah.
And that's
Mhm.
what they were ordering, and that's what the surgeon was like, "You probably need to go ahead and, tell somebody that you're gonna be in trouble because you shouldn't have done that." And I'm like, "Okay, well, that's what the anesthesiologist told me to do, and she's not okay." But anyways, I didn't get
You didn't do anything wrong.
except let her be miserable. I tried my best.
Oh,
But also
You
as a
did.
charge nurse, I think that when I became a charge nurse, it's like, you've got to step in and help, maybe
Mhm.
and
escalate.
go up the chain. It's okay.
Yeah.
If you're not getting what you need from this person, go up. There's always
Yeah.
someone higher.
Yeah.
There's always somewhere higher. Yes.
Mhm.
Well, any final thoughts? Any final stories?
We could probably yap about this for hours, but no, I thought this was good. I think we touched on
Mhm.
a lot.
Yeah. So,
Well, I hopefully this podcast, right, can help
mhm.
other trainees as well and patients and other people kind of
Yeah,
immerse in the life of healthcare providers. Is a good profession, people. I think we should
it
all
is.
feel proud about it, and I do believe we are making a difference in this world, not just in the
Mhm.
patient, but us. And Abby, thank you for having this great podcast. It's always fun.
Yeah, thanks for coming. So, I hope you all listening take a pause, whether you're in healthcare or not in healthcare, and think about those who have affected your life for good, for bad. Maybe you'll have a self reflection moment like I have, that maybe something in your youth that you thought was bad is actually someone being really helpful and really helping shape you for the better. From all of us shift talkers here, until next time, bye.
Bye. Toodaloo.
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 Good job.
If this felt like your kind of conversation, make sure you're following, leave us a review, and we'll see you back here soon. Bye.
Step into the light where the stories hum.